Hello. Good day to you, Philip. How are you? Fine, thank you. I'm well. Okay, you wrote something. You couldn't make it last lecture. Oh, um, for each semester there are like question banks, but you are not the first one to tell me that there are not. So it was, but I think it was deleted. Maybe on purpose, maybe accidentally. I don't know. There were some question banks that you could practice your questions there, but mm, yeah, you're gonna have the midterm at 14. Yeah, right. So on Saturday. So till that there is a time. 16. So that's just better. So we can review maybe next Saturday. We can review if you have any questions and you can ask me. But the material is quite easy. It's not that difficult. Difficult will be the second part where the actual disease and pathologies come in, and there are so many of them that you might get caught up and mix. But I will help you, okay? And I will direct you. So don't worry. You're gonna do well. There will be no question from the part that we have not discussed or we have not talked about or that are not included in the PPT or textbook, okay? But the textbook is an absolute necessity. You should read the book and after that review with the PPTs and video lectures, okay? Okay, I guess we're gonna let's wait for a few more minutes for others to gather up and get started. Meanwhile, I'm gonna repeat that including till the immune system. So 6 chapters gonna be included in the your midterm. Okay, nothing more, nothing less. I mean, not the 6 chapters, but 6 PPTs. I mean, including hemodynamic disorders, thromboembolic, and shock. We're gonna finish till shock. Okay, not today's lecture. Today's lecture will not be included. Okay. Yeah. Yeah, all the PPTs are on the drive. If you are not able to find them, I can send you email there. That's no problem. Okay, which one is missing? Maybe last two? If there is any missing PPT, just mail me and I will send it directly to you, okay? No problem. You still have a week ahead, so yeah, yeah. Yes, Amir, please do that.
Doctor, the last PowerPoint that is included in the exam is hemodynamics. Hemodynamics is
Six, yes, part two.
two parts.
Hemodynamics is in two parts, 5 and 6. So
Uh,
six one is the last that will be included, okay?
So five is included as well, or only six?
All of the 6 PPTs will be included. 5 and 6 are both about the chapter with hemodynamics.
Okay, once
Just
we have the drive, we have cell injury, inflammation and repair, part one, part two,
yes,
hemodynamics, part one, part two. That's all.
yes.
Five
Okay.
PPTs.
Cell injury is in two, also in two. Cell
Ah,
injury, cell death, and amputation is also in two PPTs, okay?
we have only one on the drive.
Oh, okay. I will send you the first
Second one,
or
if you
the
can.
second. Okay. Okay.
Thank you.
Okay. That was my grams. Okay. So, 2 more minutes, and I think we're good to go. So, again, I will open up the syllabus for you before we go to the lectures. And again, I'm going to repeat in order that to not to be any mix up with the material, okay? So, so this is the syllabus again and again. So cell injury was divided into two parts. So we finished this into PPTs. The next inflammation repair also in two parts as well into PPTs. And hemodynamic disorders and thromboembolic shocks also into PPTs. Totally 3 to 6. Okay, so that's it. 6 weeks material. Immune system, I made up my mind that I will explain in one lecture because it's not that big, okay? About 20 pages. So I will I will summarize those 20 pages, but you gonna definitely read them, okay? So, and that will be for the next midterm. I guess it will be till here, included 12 weeks material, okay? So in order to be fair, actually it's including genetic disease, I mean. And this part is just immune system and genetic disease are from the Robbins again. But for the rest of the pathologies, we're gonna use a different book, the oral and maxillofacial pathology. That's a great book, actually. I only have the second part of this book as the PDF version, but the first part I think it's uploaded via screen or screen pictures, I guess. But I think you're gonna make it through the PPTs. You will be able to study. Okay. And finally, those 13, 14, and 15 will be for the final exam. Okay, though these last 3 weeks material will not be included in the second midterm. Okay, that's the plan. If there is anything change in the plan, me and Dr. Solomon gonna give you a notice ahead. Okay, so you don't have to worry about that. Okay, then I guess it's just us. So let's not waste your time and mine as well. And
Going to review or to start a new lecture?
yes, I will start with a new lecture, which will not be included in this midterm, but for the next uh, midterm. Okay. Okay. Let's start with the disease of the immune system. Okay. So, first, before we turn to the disease, let's discuss the term hypersensitivity. Hyper means increase, hyper decrease. Hyper increased sensitivity. So, it's usually immunologically mediated tissue injury. Okay, hypersensitivity, in some sense, it is a protective reaction, but when it's too much of hypersensitivity, we have got the tissue injury that is immunologically mediated with the several types of the immune cells. Okay, so injurious immune reactions are grouped under hypersensitivity. Okay, and the resulting disease are called hypersensitivity disease. The causes could be different reactions, like the autoimmunity, for example. It means the reactions that organism is not able to recognize his or her own tissues and cells and produces antibodies against its very own antigen. So it's called self tolerance is failing in this case, and it leads to autoimmune disorders. It's one of the causes of the hypersensitivity reaction. The other will be like reactions against the microbes. Okay, so antibodies may bind to the microbial antigens and produce immune complexes. So antigens of microbes and antibodies of our own, which deposit in the tissues and trigger inflammatory process because those complexes are like foreign bodies. So when they are too much collected and deposited in the tissues, they cause the inflammatory reaction. So like post-streptococcal glomerulonephritis, for example. So after the body fights streptococcal infection, the glomerulonephritis. So it means those complexes, antigen complexes, precipitate in the glomerular membranes and cause the inflammation of the nephrons, inflammation of the kidneys, glomerulus. Okay, glomerulonephritis. So T cells responses give rise to severe inflammation, formation of tuberculosis, for example, the formation of the local masses, tuberculomas. Okay, and cross reactivity is believed to be the basis for rheumatic heart disease. So, rheumatoid arthritis, rheumatoid disease so post streptococcal arthritis might have also, how to say, cross tolerance, cross reaction to the heart cell, heart myocardial. So, endocarditis, streptococcal endocarditis is very common with the rheumatoid disease, so rheumatoid heart disease as well. So the other causes could be reactions against environmental agents like allergies to the normally and harmful materials like dust, like flower dust, like cat or dog food. So those also can cause allergic reactions, and some of the patients, some of the individuals are genetically predisposed to make those unusual immune responses, okay, and they are expected to have hypersensitivity reactions. Okay, and the other, so we divide the hypersensitivity reactions into four types. Okay, so the classification looks like this. Type 1 will be immediate hypersensitivity reaction. Type 2 will be antibody mediated hypersensitivity reaction. Type 3 will be immune complex mediated hypersensitivity reaction. And type 4, which is delayed hypersensitivity, is called cell mediated hypersensitivity, right? So first three are usually in acute phases, while the cell-mediated could be called chronic, while it's delayed response. Okay, so first is immediate, like allergies, antibody-mediated. Second, immune complexes, and cell-mediated. So let's discuss each of them one by one. Okay, first let's start with immediate type 1 hypersensitivity reactions. The examples could be allergies, okay, like like anaphylaxis. It could be mild to severe, starting with just itching or with the rashes, till the generalized allergy, like anaphylactic shock. Okay, so the injury is caused by Th2, those helper 2 cells, from immunology, and immunoglobulin E antibodies, which are special for the allergies, and increased also in some helminthal disease, like when the worms are there in the body. So eosinophilia and immunoglobulin E are quite common with the type 1 hypersensitivity immediate reactions. And mast cells, obviously, and the histamine release and the mediator release from that. So mast cells release mediators as on they act on the blood vessels and smooth muscles as well. So they also release cytokines, which recruit and activate other mediators and give a push to inflammatory reactions. Okay, to inflammatory cells. And tissue reactions that occur rapidly, those are classified as immediate type 1 hypersensitivity. They usually happen within the minutes, within the seconds, and after the interaction of the antigen with immunoglobulin A antibody bound on the surface of the mast cell. So when they bound to the surface, they trigger the mediator release, the muscle evaporation, and release of the histamine, release of the mediators. So antigen is called in this case allergen. So in type 1 reactions, type but hypersensitivity reactions, antigens are called allergens. So allergens. Those that cause allergies, obviously. Local reactions include seasonal rhinitis, and sometimes hay fever. A severe debilitating chronic, the turning into chronic process is called also asthma. Asthma is one of the chronic respiratory disease that the mechanism lays in the immediate type 1 hypersensitivity, right? Release of immunoglobulin, release of mediators, and constant chronic irritation of the respiratory airways, okay? And even fatal could be in case of anaphylaxis. I mentioned anaphylactic shock, which is fatal if not correctly detected and one, how to say, treated appropriately. Okay, it causes the severe swelling of the airways, a bronchospasm, a constriction of the airways, and the patient is just choking. Okay, immediate response is to give like hormones, bronchodilators like dexamethasone and adrenaline or norepinephrine. Or norepinephrine or adrenaline, those are the drugs that should be immediately administered during this shock. Okay, so, yeah, uh, and otherwise the patient will die. And sometimes extreme tracheostomy is done. So it means we make a hole in the not the common bronchi, I mean trachea, and they are through the artificial uh, hole the patient is able to breathe fine. So just this theoretical measure. So what are the sequences of events in immediate hypersensitivity reaction? So we said that there are many mediators involved in this process. So let's talk about those. So the first is activation of Th2 cells, or helper 2 cells, and production of the immunoglobulin E antibodies. And the second is sensitization of the mast cells by those immunoglobulin E antibodies. And the final is activation of the mast cells and release of those very mediators. Okay. So now mediators are in three main kinds. First is vasoactive amines. So this we know from this sounds familiar from the inflammation, but inflammation and immune reactions are close to each other, but in main sense different. Okay, so vasoactive amines include histamine, which is causes vasodilation. It increases vascular permeability. That's why it might cause the leakage of the I would say fluid into the extracellular matrix as well, and swelling and edema could be because of that. Smooth muscle contraction of the airways, and increased secretion of the mucus. So contraction airways plus increased secretion is the choking with the own mucus. Okay, chemoattractive factors for neutrophils, for eosinophils, acidic proteoglycans like heparin or chondroitin sulfate. Those are also vasoactive amines produced by the sensitization of the mast cells and activation of them. Also, we've got lipid mediators like, so that these ones were supposed to be the GIFs, but I don't know what happened to them. Okay, let's just leave them like this. So prostaglandins, they and the leukotrienes, those are the lipid mediators. Like prostaglandin D2, that might cause intense bronchospasm, increase mucus secretion. And leukotrienes D4, they are most potent vasoactive and spasmogenic agents, increasing vascular permeability, causing bronchial smooth muscle contraction. They make allergic reactions even more severe. And leukotrienes B4 and hematotic for the neutrophils, eosinophils, and monocytes. Okay. And lastly, cytokines. You've heard many times about cytokine storm that the COVID-19 causes in the human body. So, but allergic reactions also induce the cytokine um, production. So, like TNF factor, tumor necrosis factor, or chemokines, those that recreate and activate the leukocytes, like interleukin 4, interleukin 5, they amplify the Th2 initiated immune reaction. So it just builds up, unfinished, okay, and continues. So now, what is the reason of the development of the allergy? Sorry. So susceptibility to immediate hypersensitivity reactions is genetically determined. Usually, we're not saying that they're inherited genetically, but the the individual is predisposed, and or she has the much increased risk of developing allergies when there is a parent or sibling with the allergy. Okay, so they have increased propensity to develop intermediate hypersensitive reactions, and they are called atopy. Okay, reactions that is called atopy. Atopic individuals tend to have higher serum immunoglobulin E levels and more interleukin 4 producing Th2 cells. Aside from the genetic factors, there are also some environmental factors that give a push to the development of allergies. Okay, so we can fairly call the allergy multifactorial disease because not just genetics is involved, but also some environmental conditions as well, like hygiene hypothesis, for example. So incidence of many allergic disease is increased in the developed countries related to the decrease in the infectious during the early life. So as the medicine evolves, as the industry evolves, um, the many of the infectious disease decrease in rate because there is a treatment available, there is a vaccination, but it leads to consequent increase in allergic reactions. So allergic reactions are called modern life disease. They are, I'd say, developed countries disease. Okay. So too much hygiene in childhood may increase allergies later in life. Too much hygiene might prevent infectious disease, but might increase the allergies later in life. Okay, so what are the clinical and pathologic manifestations of the type 1 hypersensitivity reaction? So, as I said, it is the immediate response. It develops within a minute, within the seconds of the meeting of the antigen with antibodies. It's stimulated by the muscle granule contacts and lipid mediated, which we have listed, and is characterized by vasodilation. Sorry, I gotta take this one. Алло? Melexia за adresarul knebim glengash. Okay, sorry. Yeah, work. Vasodilation, vascular leakage, and the smooth muscle spasm, and usually evident within 5 to 30 minutes after the exposure to an antigen and subsiding by the 60 minutes. So in 1 hour, the reaction is almost over, but it starts within the minute, okay? Within the half hour, within the 5 minutes. So it's immediate reaction. So an immediate hypersensitivity reaction may occur as a systemic disorder or could be as a local reaction. So local reaction, for example, I have the allergy on this watch, and when I take it off, I don't really have it. So I might have the dermatitis, okay? I might have like pustulas allergic reaction to it after just wearing it. So, or I might have systemic reaction like it means it was a local reaction at the place of the contact, okay? And I might have not me, but someone else, someone we don't know. Someone might have so it's eaten, for example, peanuts, and he or she has a peanut allergy, and he's now choking, and it's anaphylactic shock and a one step uh, from the death. Okay, so that's the two sides of the one same condition. Okay, so systemic exposure to protein antigens or drugs, for example, might cause systemic anaphylaxis within the minutes of the exposure in a sensitized host. Sensitized host it means that once you have already met this antigen, so when you meet it for the first time, the immune system takes a time to produce antibodies against it. But when you minutes for the next time. And the immune system has a great memory, and it doesn't take all the time to process, but directly, immediately produces antibodies. So, when there is a sensitized host, in this case, itching, urticaria, yeah, itching, and the skin erythema appear quickly, immediately, and followed by the profound respiratory difficulty, a pulmonary bronchoconstriction, a hypersecretion of the mucus that worsens the respiratory failure, and vomiting, additionally, choking, abdominal cramps, and diarrhea that might lead to the full picture of the anaphylactic shock. Okay. Sure. So, and the local reactions, as I said, atopic dermatitis, for example, irritation of the skin, food allergies that might cause, and hay fever, for example, and certain forms of asthma without the generalized forms. Okay, so those are the local reactions. Now, again, let's continue with the clinical pathologic manifestations. So, late phase reactions, what are those? Those reactions that are stimulated mainly by the cytokines and which usually set in 2 to 8 hours. So, not immediate, but the late phase reactions, but still within the hours. So, they may last several weeks. So, not like hours, but several weeks, and characterized by the inflammation and the tissue destruction, such as mucosal epithelial cell damage. Dominant inflammatory cells are, in this case, neutrophils, eosinophils, lymphocytes, and T helper 2 cells. Okay, and now, so that was all about the hypersensitivity 1 immediate reactions. Now let's talk about the type 2 hypersensitivity, which is called antibody mediated disorder. And as you can guess, the main players instead of immunoglobulin E, we've got here antibodies, right? So it's caused by the secreted immunoglobulin G, immunoglobulin M antibodies, and bind to fixed tissue or the cell surfaces. And antibodies injure cells by promoting their phagocytosis or the destruction, lysis, okay, by inducing inflammation as well. So antibody complex antigen antibody complexes is the next type, but they don't mix them together. Okay, so they interfere with the cellular functions and cause disease without the cell or tissue injury. They initiate induce inflammation and phagocytosis and lysis of the cells. Okay, so the steps that the type 2 hypersensitivity take is first is opsonization and phagocytosis. Opsonization is the adding up opsonins, the particles that make it easier to detect and eat it up. Okay, so opsonized, it means coated like this, coated and autoantibodies with and without complement proteins. The cells become targets for the phagocytosis. They easily attach to the phagocytes, and by neutrophils and the macrophages, they are phagocytes. Yep, that's the process. Okay, so again, it could be the example. Other example is the transfusion reactions. For example, they are not immediate reactions, but they're a bit later, but the cells from the incompatible donor react with the preformed antibodies in the host. So we about the blood groups and about the RH factors. We're going to talk in a few next lectures, but still we have different types of groups at this level we know that. So and transfusion of incompatible, it means from the different group, might cause the antibody mediated disorder, so type 2 hypersensitive reaction that could be fatal. That's why it's prohibited, um, unless there is emergency and there is no way out and you can make it any worse. So it's prohibited to transfuse incompatible blood, okay, or even the blood that is still compatible but with the different groups. So we usually use it the same group with the same resources. Just we know about the universal donors or universal recipients, but we don't use that in nowadays. We as much as possible as with the same group, but still there are, for example, acute bleeding. The patient has lost 4 liters of life, and this kind of loss is almost incompatible with the life. So in these cases, and we are short of blood banks are short of the same group, we can still use um, first group blood. No, no. If the patient is the first group, we can transfer. So it means that well, we know that we will learn that. Till now, it's not quite necessary to know that. Okay. So, so the one example was the neurotransfusion reactions. The other is hemolytic disease, for example. Erythropoiesis fetalis, immunoglobulin anti-red blood cell antibodies from the mother cross the placenta and cause the destruction of the fetal red cells. Usually, that's because of the rhesus factor, RH factor. So I have a first group blood, but I am RH negative. Okay, if my fetus, my or any mother's fetus who has RH negative blood and fetus has RH positive blood, it means mother's antibodies attack the fetus. It means they cross the placenta barrier, they cause the severe hemolysis in the kid, unless mother is already so it's usually does not lead to fatal outcomes in the first pregnancy. But when the mother is already sensitized, so the second pregnancy with might also end with abortion, okay, or with fetal severe abnormalities or even death, okay, or premature labor and hemolysis that is incompatible with the life. So, but in case of if we take antibodies and if we inject immunoglobulin, for example, for that the mothers will not how to mother's antibodies will be blinded. They will not fight against the fetus one. Okay, they will be occupied with fighting the others. So it will be less severe, and it's not an issue anymore in the modern medicine. Okay, but it was back when there was no ways to treat that incompatibility with the mother's fetus age factor. So that's also ahead. We're going to talk about it closer in the next few lectures. So, meantime, so for this time, just to know to list the hypersensitivity reactions examples. Okay, so the other is autoimmune hemolytic anemia, granulocytosis, thrombocytopenia, that when in case the antibodies are produced against their own blood cells. Okay, so here you see the sickle cell anemia actually, and hemolysis occurs not with them, might be there is an autoimmune hemolysis, but usually because they sickle shaped erythrocytes have no elasticity and they are not able to squeeze through the small vessels. They just get stuck and can undergo the lysis. Okay, that's the reason usually. And drug reactions. Okay, type 2 hypersensitivity is also drug reactions. It means that against the drug uh, protein complexes can develop. Some of the drugs might cause the reactions like allergic reactions as well, but this is type 2. Okay, drug reaction, antibodies against drug protein complexes. Okay, so what are the steps of the type 2? Type 1, we need this mast cell activation, production of mediators. Now, what about type 2? So first is, um, okay, I think we are halfway through. Okay, let's finish this type 2 and have a break because from the morning I had a lecture and yesterday I was on duty and I'm losing my voice, I guess. Yeah, inflammation. It's to activate the complement system engagement of the FS receptors. I don't really remember what those are. Like example is the glomerulonephritis. It means that again, antibody those complexes I would say precipitate in the membranes of the glomerules, so they cause the inflammation there. Vascular rejection of organs in organ grafts. Usually, those are delayed reactions, type 4 reactions. But in this case, vascular rejection happens quite immediately, and that is why they are referred to the antibody mediated disorders type 2. And antibody mediated cellular dysfunction, that is my like in myasthenia gravis, for example. This is the severe and very rare but the neuromuscular disease, degenerative disease. It's antibodies develop against acetylcholine receptors in the motor and plates of the skeletal muscles, and they inhibit neuromuscular transmission with the resultant muscle weakness. Okay, and there's inability twitching in the muscles, and they undergo finally atrophy, and just the ability of the movement is lost. Graves' disease, you know that's antibodies develop against thyroid stimulated hormone receptor. Thyroid epithelial cells secrete the thyroid hormones, resulting in hyperthyroidism. Bazadov syndrome, so called Graves' disease. Okay, thyroid toxicity. And yeah, time for the break. Okay, I'll be back in 10-15 minutes. Okay, thank you. Okay, let's get back to where we stopped. So type 2 hypersensitivity reactions, they are called immune complex mediated disorders. Okay, as you can see from the title, that is, the immune complex is made up of antigen antibody, but not the antigen antibody. Immune complex could be other than that. So, like immunoglobulin G, immunoglobulin A antibodies that bind with the antigens usually in the circulation and form antigen antibody complexes. Okay, so they deposit in a vascular bed and induce complement activation as well as an acute inflammation. Okay. So the leukocytes that are recruited, like neutrophils or monocytes, they produce tissue damage by release of lysosomal enzymes and the generation of the free toxic radicals. So that's the mechanism of the destruction in this case. Those complexes may be formed at the site where the antigen have been planted previously in situ at the site of the immune complex, or it could be anywhere like in kidney. It might cause the glomerulonephritis in joints. It causes arthritis. In small blood vessels, it causes vasculitis. And itis is the suffix for the inflammation, as I mentioned when we talked about inflammation and repair. Okay, so when we see the suffix itis, we mean immediate inflammation. And also, acute serum sickness is the example of type 3 hypersensitivity. It's in individuals who receive antibodies from other individuals or species. Okay. And now, formation of immune complexes. In the first week after the injection of the proteins, usually, and the, sorry, the position of the immune complexes. First is formation, then is deposition in glomerulus, in the joints, in the vessels, anywhere else, and inflammation and the tissue injury gets started. And complement activation, engagement of the leukocytes, antibodies, immunoglobulin G, and acute vasculitis like fibrinoid necrosis of the vessel wall or intense neutrophilic infiltration. And glomerulonephritis, arthritis are those examples of the immune complex mediated type 3 hypersensitivity disorders. So arthritis reaction is also a type 3 reaction. It's local immune complex disease, as you can see, seen and noticeable on the skin, arthritis reaction. And it's the apparent tissue necrosis as a result of acute immune complex vasculitis. Lesions evolve over a few hours and reach a peak about 14 hours after the injection of the antigen antibody or antigen usually with the injection site develops edema and the hemorrhage usually occasionally followed by the ulceration because of the tissue damage and necrosis, caused mainly by the immune responses in which T lymphocytes of the Th1 helper 1 and Th17 subsets produce the cytokines. Okay, they induce inflammation and activate neutrophils and macrophages, which are responsible for the tissue injury. So, like CD8, CTLS, they are also may contribute to the injury by directly killing the host cells. Okay. Now, that was all about type 3. Now, the last type 4 hypersensitivity, which is delayed hypersensitivity, and it is called T cell mediated hypersensitivity reaction. And here you see the, granuloma that is very common with the type 4 reactions. Okay. So cytokine-mediated inflammation, usually their name, they are produced mainly by CD4 T cells, and it direct cell cytotoxicity, which is mediated by the CD4, CD8 T cells as well. So we've got to cytokine mediated by CD4 and direct cell cytotoxicity mediated by CD8. Delayed type of sensitivity, as I mentioned, because it doesn't happen within the minutes and seconds, and it's with the 24 hours, within 2 days, okay, 20 to 48 hours. Tuberculin reaction, for example. So when you perform PPD test, it's purified protein derivate or tuberculin skin test. So Mycobacterium tuberculosis, to detect it, it's reddening, and the duration appears about 8 to 12 hours, reaches its peak in one day and or in 3 days, okay, 24, 72 hours. Granulomatous information is the clinical sign. It means formation of the granulomas, okay? And large, flat, and eosinophilic epithelioid cells are characterized as giant cells, so-called, and multinucleate giant cells. They form multinucleate having many nucleuses, uh, forming the granuloma that is apparent without the with the bare eyes as well. Okay, so what are the examples of the T cell mediated hypersensitivity type 4? Contact dermatitis, for example, evoked by the contact with the usual. Okay, with the metals, for example, the antigen component of the poison ivy or poison oak that causes vascular dermatitis, which is very apparent in here, and rheumatoid arthritis, for example, multiple sclerosis, the other example, inflammatory bowel disease is also T cell mediated type 4. And that's quite it. Those are the examples of type 4 delayed hypersensitivity. And delayed, for example, transplantant rejection reactions as well. So those are T cell mediated ones as well. So now let's talk about some autoimmune disease. Not all, but some of them. So autoimmunity, we defined what it is. It refers to immune reactions against self. Auto means is self antigens. Okay, so organ specific could be immune responses are directed against one particular organ or a cell type and result in localized tissue damage. Or could be systemic, not to organ specific, but systemic if the characterized by lesions in many different body systems and organs. Collagen vascular disease or connective tissue disease, for example, those are located at the various locations in the body, so they are like systemic. Okay. And about the terms immunologic tolerance. What is immunologic tolerance? So it's a state of unresponsiveness to an antigen that is induced by exposure of specific lymphocytes to that very antigen. And self-tolerance means the lack of immune responses to one's own antigen. That's a good thing. Self-tolerance means we are not detecting our antigens as the foreign, so we have a self-tolerance. We don't produce antibodies against ourselves. But when there is a self-tolerance disturbance, we've got a problem there. So central tolerance means the antigen-induced deletion or of the self-reactive T cells during their maturation in the central generation, lymphoid organs like thymus, like bone marrow, and so on. And peripheral tolerance, it's the silence potentially autoreactive T cells and B cells in the peripheral tissue. So let me make it red as well. So normally we've got self-tolerance, which is could be central and which could be peripheral, including to the cells it is supposed to be. And energy, what does it mean? Energy, it's a functional inactivation, having no tolerance, having tolerance to everything, to the central, to the peripheral, to everything. Okay. Suppression by the regulatory T cells and deletion by apoptosis. Okay. So now let's discuss some general principles of the autoimmunity. Breakdown of the self-tolerance and the development of the autoimmunity result from the combined effects of the susceptibility genes, which influence lymphocyte tolerance, environmental factors such as infections, tissue injury, and alter the display of the responses of the cell antigens. Yeah. And the first example, first autoimmune disease I want to discuss with you is lupus erythematosus. It's a systemic disease. It means it just not involves one body system, one organ, but the complex of the organs and body systems. Okay. So systemic lupus erythematosus, it's an immune disease involving multiple organs characterized by the vast array of antibodies, particular anti-nuclear antibodies. So it means against the nucleated cells, and in which injury is caused mainly by the deposition of immune complexes, so type 3, and binding of antibodies to the various cells and tissues. Injury happens not just to one system, it includes skin, joints, kidneys, serosal membranes, and virtually every organ in the body that might have a nucleus, okay? Because we've got anti-nuclear antibodies in us there. So, anti-nuclear antibodies, there are antibodies to DNA. To nucleus, it means nucleus is the mother place for the DNA, right? Antibodies to histons as well, to proteins that make up the chromosomes, and antibodies to non-histone proteins that are bound to the RNAs usually, and antibodies to nuclear antigens as well. So those are the main antibodies that are found during lupus erythematosus. So what are the genetic factors? Familial association, HLA association, genetic deficiencies, and those are also genetic factors that contribute to the lupus erythematosus. Environmental factors include exposure to the ultraviolet sunlight, gender bias, usually females, and drugs such as hydrolysine, isoniazid, procainamide, and d-penicillamine. Anti-TNF therapy is a trigger of the disease, which is effective in rheumatoid arthritis and other autoimmune disease, but also can cause drug-induced lupus. Remember this one. And what is the mechanism of the injury during lupus erythematosus? As we said, antigen antibody complexes that precipitate in different organs, right? So most of the systemic lesions are caused by immune complexes, type 3 hypersensitivity, and antibodies of different specialties, specifications contribute to the pathology and clinical manifestations of the systemic lupus erythematosus, and also type 2. Okay, and secondary antiphospholipid antibody syndrome. It's linked with the lupus usually, but it holds differently. So venous and arterial thrombosis, which may be associated with the recurring spontaneous miscarriages, and focal cerebral and ocular ischemia. So these syndrome is often associated with the lupus, and it leads to during the pregnancy of such patients they have spontaneous abortions, loss of the fetus, and many complications. Okay, neuropsychiatric manifestations are also common during the systemic lupus erythematosus. Now, morphology, I will not stop in here. I have discussed all the changes that blood vessels undergo, kidneys undergo, the different types of classes of changes, which is for assignment for you to read it. Okay, I have just summarized it. You have questions about those in the second midterm, so read it, please. Okay, good. So, what are the clinical manifestations now? Skin, we know we have a rash, butterfly like rash. So, it's called erythema, affects the nose along the bridge of the nose and the cheeks. So, it looks like much butterfly rash, and this is usually in half of the patients present. Okay, similar rash also may be seen in other in the extremities, on the trunk. So, that's specific characteristic of the lupus erythematosus. Urticaria, bullous or the pustulas, maculopapular lesions, ulcerations also might occur. Exposure to the sunlight inside of those and attenuates the erythema, so it makes even more severe, okay? Like aggravates the situation. And vacuolar degenerations of the basal layer of the epidermis. In the dermis, we've got variable edema and perivascular inflammation, vasculitis and necrosis of the vessel bed. That's quite prominent, and these findings not diagnostic for the systemic lupus erythematosus is sometimes seen in scleroderma as well, which we're gonna go see in, and dermatomyositis as well. But still, butterfly rash is the clinical sign of the lupus. Okay. So, what are the systemic manifestations? Joints. If it affects joints, it might cause non-erosive synovitis with a little deformity, with a contrast of the neurorheumatoid. That's right. So you cannot mix those two. Central nervous system. What happens? Non-inflammatory occlusions of the small vessels by intimal proliferations, which may be due to endothelial damage caused by antibodies or immune complexes. Pericarditis, other serosal cavities like involvement, inflammation in the surroundings of the heart could be acute, subacute, or chronic. And cardiovascular system, which is a very cardinal feature, it is called Liebman-Sachs endocarditis, valvular endocarditis, means the inflammation of the valves, okay? Which is more common to the widespread use of antibiotics. That is also common. Liebman-Sachs endocarditis. Okay. So, the spleen. Splenomegaly. It means enlargement of the spleen, capsular thickening, and follicular hyperplasia. In the lungs. The pleuritis, it means the effusion and the inflammation of the pleural coverings, chronic interstitial fibrosis, secondary pulmonary hypertension as well. And lupus erythematosus, the hemotoxylin, those bodies are lupus cells, so-called cells, and the bone marrow or other organs are strongly indicating about the systemic lupus erythematosus. Lymph nodes may be enlarged due to hyperplasia of the B follicles and even demonstrate the necrotizing. Okay, I guess we could. So clinical features again. Let's continue. So butterfly rash, fever, pain without deformity of one or more joints that differs it from the rheumatoid arthritis. Hematuria, it means red urine, red blood cell cast, and proteinuria. Nephrotic syndrome, it indicates the nephritis and the stage of stages of nephritis, anemia, thrombocytopenia, psychosis and convulsions, coronary artery disease. So that is all because that is all the reasons that it's called systemic because it attacks poly organs. I know it's many systems are attacked by those antibodies and antigen antibody complexes. Okay, so that's what systemic lupus erythematosus. So, and the other autoimmune disease is rheumatoid arthritis. It is an autoimmune disease that affects primarily the joints, but also may involve extraarticular tissues such as skin, blood vessels, lungs, and heart. Okay, so the destruction of the articular cartilages and ankylosis of the joints, it means adhesion and the disruption of the joints, so they are not able to move them. Okay, And yeah, that's all due to autoimmune reactions against the joints. So inflammation localizes to the joints, recruiting macrophages and triggering activation and proliferation of the synovial cells, chondrocytes, and fibroblasts. So, penis is the mass of the edematous synovium, inflammatory cells, granulation cells, the fibroblasts that grow over the articular cartilage and cause the erosion from a fibrous ankylosis, as you can see, and which may later ossify. So these are stuck. Okay, these are stuck, and cause the bony ankylosis. Okay. Rheumatoid nodules are an infrequent manifestation of rheumatoid arthritis and uh, typically occur in the subcutaneous tissue, including the forearm. I'm sorry, I gotta take this one. Алло, გამარჯობა დროსკა, კარგად თავად როგორ ხართ? დიახ. როგორც გუშინ დღეს ლექცია მაქვს არ ვიყავ, მაგრამ არ ვარ და გუშინ ვნახე, ჩვეულებრივ რეანიმაციაში აპარატზე რჩება ძინავს პერიოდულად. დაკლებულია ეს დოზები, მაგრამ ძილი გრძელდება, იმიტომ რომ ცუდად იღვიძებს. დაჟეჟლობა რჩება, მაგრამ ანუ საგანგაშო დინამიკა არ აქვს ნევროლოგიის მხრივ. ჩარევას არ საჭიროებს, ამ ნეიროქირურგიულ ჩარევას ამ ეტაპზე არ საჭიროებს. სტაბილურად, მაგრამ მაინც მძიმე რჩება. ეს კრიტიკული პერიოდი ცოტა დარჩა, პრაქტიკულად გაიარა, ასე ვთქვათ. მთავარია ახლა დრო. აჰა. ხო, ანუ ეს ხანგრძლივად ინტუბირებული რო არის, შეიძლება ტრაქესტომია გადაწყვეტონ, ანუ ინტუბაცია პლუს იწვევს ამ ნახოს და მერე პნევმონიის რისკი იზრდება რეანიმაციაში, როცა არის და შეიძლება ტრაქეოსტომია შეთავაზონ, ანუ უფრო უკეთესად დასანირდეს და რისკიც ნაკლებია პნევმონიის. ეს უკვე მერე ანუ ანუ ეხლა ხო მილი აქვს ჩადგმული პირის ღრუში და ანუ ნახრებს გააკეთებენ ტრაქეას სასულეზე და იქ ჩადგავენ უფრო და ინფიცირების რისკი ნაკლებია და უფრო კარგად მარტივად ახლოს არის სასუნგზებთან და კარგად სანირდება რომ ნახველი ბევრი არ დაგროვდეს. ნუ ეს მერე ხანგრძლივი ინტუბაცია თქვა 21 დღეზე მეტი თუ ანუ ორ კვირაზე მეტი თუ დასჭირდა ან მომავალში თუ თვლიან რომ კიდევ ვერ მოიხსნება აპარატიდან იმ შემთხვევაში აკეთებენ ამ ჩარევას. აჰა. ცუდი არ არის, ანუ საჭირო საშიში არა. ანუ მძიმე ტრამვაა, მაგრამ მთავარია რომ გაუარესება არ არის და სიცოცხლის საშიში ასე ვთქვათ პერიოდი გადავახა. მაგრამ ანუ დასაბუთებით ასე ვთქვათ დარწმუნებით ვერაფერს გარანტირებულად ვერ ვამბობთ ჯერჯერობით. აჰა. კი, კი. კარგი, დამშვიდობას გისურვებთ. Sorry guys, I have to make a call. Sorry. That's emergency. Sorry, guys, I'm missing the work today, so I've got a lot of uh, phone calls. Just a few slides, and that will be over. So, the other disease aside from the lupus erythematosus and the rheumatoid arthritis, we've got Sjogren's syndrome. Sjogren's syndrome is characterized with a keratoconjunctivitis sicca. It means dry eyes, and with the dry mouth, that is xerostomia. Okay, so it results from immunological mediated destruction of the lacrimal and the salivary gland that leads to the dryness of the mouth as well as for of the eyes. So most commonly met in the women between 50-60 years, and blurred vision is the accompanied with the Sjogren's syndrome. Burning agent cessation, thick secretions that accumulate in the conjunctival sac as well. So, xerostomia results from the difficulty of the swallowing food, decrease in taste, cracks on the features of the mouth, and dryness of the buccal mucosa as well. Synovitis, pulmonary fibrosis, peripheral neuropathies, renal acidosis, and those are also the features, clinical features of the Sjogren's syndrome. 60% of the patients they have another accompanied autoimmune. More than half of the Sjogren's syndrome patients they have other autoimmune disease like rheumatoid arthritis, for example. Okay. And lastly, systemic sclerosis. It's a scleroderma, so called. It's an immunologic disorder characterized by excessive fibrosis in the multiple tissues, obliterative vascular disease, and evidence of autoimmunity. So it causes diffuse systemic sclerosis, initially widespread skin involvement with the rapid progression and early visceral involvement. Okay, CREST syndrome is the one clinical manifestation of scleroderma. CREST, this is the abbreviation for the C is for calcinosis, R is for Raynaud's syndrome, Raynaud's phenomena, E is for esophageal dysmotility, this moment, sclerodactyly, sclerotic fingers, and telangiectasia that gives this color. Okay, so CREST syndrome is abundant for the scleroderma. Okay, and clinical features mostly in female, so gender. I'd say priority here. Peak incidence is 50-60 years age. She has features with the lupus erythematosus, arthritis, so that's why they are easily mixed up. But they have cardinal features that makes them a little bit easier to search them to give a right name. So they have striking cutaneous changes, notable skin thickness, sclerosis. Sclerosis means thickening. Okay, and Raynaud's phenomena, it's episodic vasoconstriction of the arteries and veins in the extremities that give this coloring to the extremities. Okay, Raynaud's phenomenon. Okay, again, progressive depositions in the skin that leads to the it looks like rheumatoid arthritis, but it's different because skin is remote sclerotic sclerosis, and also Raynaud's syndrome is a part. And nephrotic syndrome, it's a malignant hypertension that is fatal, that leads to fatal renal failure. Is also one of the features of the uh, scleroderma. So that's quite all I wanted to talk about today. It was a short lecture and it was intended for 2 weeks, but I guess we are good to finish it in 1 week. So we have an extra week if we need it when we go to the pathologist. Okay. Do you have any questions? Was everything clear with today's lecture? No questions from me. Everything was clear. Thank you, Philip. Thank you for your response. Okay, uh, for the exam, just PPT closure. No, not just PPTs, but chapters as well. Okay, just four chapters. Okay, four chapters. Two, three, four. Not four, but three chapters. Okay, two, three, and four chapter from the textbook. PPTs will help you to review, but you need to read the textbook. Okay, okay. Thank you. Thank you very much. See you on Saturday. Today's lecture will not be included. Thank you. Including six PPTs, three chapters from the book, 6 week material. Okay. Wish you good luck. We're gonna meet on Saturday, and if you have additional questions, we can discuss them by that time. Okay. Bye bye. Have a nice week ahead of you, and don't be lazy. Study hard, read the book, and stay safe. Okay? Most importantly, be healthy. Eat well, sleep well, and drink well. Bye bye.